Stephen Hawking recently wrote a column for The Guardian in which he called out Jeremy Hunt's approach to reforming the National Health Service and the evidence that he supposedly uses to back the changes that he's pursuing. This piece, called "The NHS Saved Me. As a scientist, I must help to save it," opens with this, quote, "Like many people, I have personal experience with the NHS. In my case, medical care, personal life and scientific life all are intertwined. I have received a large amount of high-quality NHS treatment and would not be here today if it were not for the service." He goes on to explain more recently, quote, "Last year, my personal experience of the NHS and my scientific life came together when I co-signed a letter calling for healthcare policy to be based on peer-reviewed research and proper evidence. The specific issue addressed in the letter was the, quote, weekend effect." Now, what is the weekend effect for those that don't know? This is Jeremy Hunt's claim that significantly more people have been dying at the weekend due to poor hospital care at that time. And his answer is this concept of a 7-day NHS, which isn't really a 7-day NHS. It's just taking the existing resources that are already there, the existing staffing levels, and stretching them across 7 days.
Because health workers aren't massively overstretched enough.
Yeah, I mean, they're already overstretched as it is. Let's just, spread that a bit further onto the weekend.
You guys are fucking sadists.
It's almost as if you did that, it would collapse. And then you could just sell it off to all your friends. Anyway, This is obviously Stephen Hawking. I mean, for those that don't know who Stephen Hawking, give it a little brief rundown. Alex.
Massively notable physicist, wrote a brief history of the universe, I think. Famous for being a paraplegic. Also, very long-term socialist. Refused a knighthood because he doesn't believe in the monarchy. Generally cool guy. They made a kind of mediocre film about him a couple of years ago. But like, if you have like 2 hours to spare, that'll bring you up to speed.
Okay. So he's pretty... And obviously Jeremy Hunt is the health secretary that we're talking about, for those that don't know. So Hawking mentions in his piece, he does have sympathies to the idea of wanting more weekend services. He'd like that to be a thing. But Hawking, as many others have done in the past, explains and points out that the evidence that Jeremy Hunt is basically picking up and using is cherry-picked. It's not good enough. There's more to be looked at. And what he's describing, this weekend effect, isn't the full picture, and that should be taken into account. He explains, quote, "When public figures abuse scientific argument, citing some studies but suppressing others to justify policies they want to implement for other reasons, it debases scientific culture." He doesn't mention it in the article, but 4 of the 8 studies cited by the health secretary were not peer-reviewed. So that, half of the ones he's looking at are not peer-reviewed studies. And 13 papers that contradict everything that Jeremy Hunt's going for are just ignored. And people have pointed them out to him lots and lots of times. Later on in the article, Hawking does describe the situation of healthcare in this country in terms of 2 different forces with differing interests. And the same can be said for America, the same can be said for other Western countries, but particularly the UK and the US. Let's just see what he has to say, because this is some important quotes. "On the one hand, there is the force of the multinational corporations, driven by their profit motive. In the US, where they're dominant in the healthcare system, these corporations make enormous profits. Healthcare is not universal, and it is hugely more expensive for the outcomes patients receive than in the UK. We see the balance of power in the UK is with private healthcare companies, and the direction of change is towards a US-style insurance system. If that all sounds political, that is because the NHS has always been political. It was set up in the face of political opposition. It is Britain's finest public service and the cornerstone of our society, something that binds us together. People value the NHS and are proud that we treat everyone equally when they are sick. The NHS brings out the best in us. We cannot lose it." So he's laying it out there that, first of all, the end goal for people like Jeremy Hunt and a lot of the Tories is a US-style insurance system. And people like Laura Kuenssberg, the BBC political editor, have actually said that, off the record, Tories would just want to get rid of the NHS and have that US insurance-style system.
It's an open secret.
Yeah, but on the record, that they know they can never publicly say it. They know they cannot do that because they cannot make that goal clear.
Yeah, not only would it be atrocious as a policy, but it would reveal to everyone exactly what the Conservatives are and the way that they view the way that a state should be run.
Case in point, Paul Nuttall, when he came out with those statements.
Yeah, which he was rightly completely eviscerated for.
So like we all said already that Jeremy Hunt's changes to things like the junior doctor's contract basically boiled down to getting what's already there, the current resource levels, the current staffing levels, and push them onto the weekend, stretch them a bit further.
Because God forbid you might tax people more to actually properly fund things.
What was the response to this? Of course, Jeremy Hunt, being in this boxing match, had to hit back against one of the most prominent thinkers of our time.
Why not? I'm sure he's going to do just fine in that comparison.
Let's roll in with these tweets. What did Jeremy Hunt have to say? Number one, first one, he goes, Stephen Hawking is brilliant physicist, but wrong on lack of evidence for weekend effect. 2015 Fremantle study most comprehensive ever. And whatever entrenched opposition, no responsible health secretary could ignore it if you want NHS to be safest health service in the world, as I do. A day later, because that was on August 18th, the next day he tweets some more, following things like this article. Most pernicious falsehood from Stephen Hawking is idea government wants US-style insurance system. It is too much to ask him to look at evidence. NHS under Conservatives has seen more money, more docs and more nurses than ever in history.
Again, less per person.
Exactly.
It is in no way rising in comparison to what needs to be made available to it.
Those with private med insurance down 9.4% since 2009. But like you say, this is what the Tories always do. And Theresa May's done it so many times at the dispatch box. They're like, record numbers of people doing this, record numbers of money going into the NHS. I mean, this is one particular example. The pound is not the value it was in 2009 as it is now. There's differing amounts there. So you can't equate how much was put into the NHS then as like just a raw number as you can now.
Yeah, but of course, people don't really know that, and so they want to make it very clear that they think you can.
The Daily Mash came out with a great article, an absolute brilliant one. Hawking discovers new super dense black hole. Professor Stephen Hawking has discovered the densest thing in the known universe. And there's, loads of replies to Jeremy Hunt on his own Twitter feed as well. One Martin McKee, who's Professor of European Public Health at the London School of Hygiene and Tropical Medicine.
Hell yeah.
Who said he'd been writing on these subjects on hospital mortality for like 22 years. Was tweeting back like, yo, look at this link. Boom, boom. It's just there in the thread. You can see it. Surely Jeremy Hunt sees that, the amount of stick he gets on Twitter.
I mean, I don't think he... I imagine there's probably some, very nervous aide who just hasn't told him.
Yeah.
He just goes, what did they think of my proclamation? And this kid goes like, oh, they love it. You know what they're like.
He's the longest serving health secretary. I can't see how much more he can last.
Yeah, I mean, he's extremely bad. The NHS is in a shambles compared to the health it enjoyed even a decade ago. And it's just shocking to see the way it's been desolated, especially considering how slow the economy has been, because government spending like this can drive demand that can help to provide a real push for an economy. But for ideological reasons, the Conservatives don't want to do that. The Conservatives want to starve public services because the goal of the neoliberal project and the kind of end point for the neoliberal mechanism is the destruction of the public square. It is the end to public services because they could be privatized, and so by the logic of these people, it should be. It's frustrating to see this just ridiculous shambling idiot kept around despite humiliation after humiliation. It's just stunning.